Welcome to the Science of Hockey, the podcast where we break down the science behind ice hockey. I'm the analyst, your host, and every week we explore the data, research, and evidence that shape how we play, train, and understand the game of hockey. From biomechanics to performance psychology, we take you beyond the rink and into the research lab, giving you insights that go beyond hearsay and into what really makes the difference on the ice. Whether you're a player, a coach, a parent, or just someone passionate about the sport, we're here to bring you scientifically backed information in a language that's friendly and easy to understand. So grab your skates and let's dive into the science of hockey. Hey there, hockey fans. Welcome back to the Science of Hockey. I'm the analyst, and today we're tackling an incredibly important topic in the world of ice hockey, concussions. In this episode, we'll break down the findings on concussion risk factors, injury mechanisms, and clinical presentations in both male and female Division I ice hockey players. We'll explore how factors like previous concussions, mouthguard use, and differences between male and female athletes influence both the risk and recovery from concussions. Whether you're a player, coach, or just a fan of the game, understanding the science behind concussions is crucial for keeping athletes safe on the ice. So, strap on your helmets and let's get into it.
All right, welcome back, everyone. Ready for another deep dive?
Absolutely. Always up for a good deep dive.
Awesome. So today, we're strapping on our helmets and hitting the ice to tackle the weighty topic of concussions in Division I hockey.
Oh, yeah. Big topic for sure.
Yeah. You know, there's so much we hear about concussions these days, but I really want to get into the specifics of the risks in hockey, especially how they might differ between men's and women's leagues and what recovery really looks like.
Right.
So we're going to be digging into a 2021 research article from the Journal of Sport and Health Science, which uses some really interesting data from the NCAA and the Department of Defense, too.
Okay. Interesting combination.
Yeah, it's a pretty fascinating study. And let me tell you, some of the findings really caught me off guard.
Oh, color me intrigued. What kind of findings are we talking about?
Well, one thing that really jumped out at me was how this study kind of challenges some of the assumptions we have about what causes concussions in hockey.
Yeah, you always hear about the big hits being the culprit, right?
Exactly. But it turns out it's not always that straightforward.
So what are some of the, less obvious risk factors this study highlighted?
Well, I was actually hoping you could shed some light on that. What were some of the things that surprised you?
You know, it's fascinating because one of the major findings was that having a previous concussion significantly increases the risk of having another concussion.
Well, that makes sense, though, if the brain is already vulnerable from that initial injury.
Yeah, you're spot on. Having a concussion in the past basically doubles your chances of having another one, which really underscores how important it is to, allow for a complete recovery and have those careful return-to-play protocols in place.
Right, absolutely.
And then the second factor that really stood out might surprise you a bit.
Okay, I'm all ears. Hit me with it.
Mouthguard use, or I guess lack thereof.
Oh, really?
Yeah, players who didn't wear mouthguards had a 57% higher chance of getting a concussion.
Well, I have to admit, I would not have guessed that. I always thought of mouthguards as mainly for protecting your teeth.
Right, that's the common thought.
So is there evidence that they actually directly protect the brain?
Well, the study actually delves into that a bit. It seems like there might be a bit more going on than just, a physical barrier.
Right.
While they do offer some protection, the researchers think it might also be an indicator of a player's overall approach to the game. Like, they tend to be more cautious players in general.
So choosing to wear a mouthguard might actually signal a different, mindset on the ice.
That's a fascinating point.
Yeah, a lot of nuance there.
Absolutely. But you mentioned those risk factors apply to both men and women. But, women's hockey has different rules. They ban body checking, right?
Mm-hmm.
So I'm curious, do the injuries themselves actually happen in different ways?
It's a great question, and you would think so, right? But the study actually found that player-to-player contact was still the most common cause of concussions for both men and women. So even without those intentional big hits, those incidental collisions are still a major factor.
Exactly. But having said that, there were some pretty interesting trends that did differ between the men's and women's game.
Oh, like what?
Well, for instance, most of the male concussions happen kind of mid-season.
Okay.
Whereas for women, they were more concentrated early in the season.
Huh. That's really interesting. What do you think could explain that difference in timing? Could it be related to like the intensity of the game increasing as the season goes on, or maybe something to do with their training regimens?
Those are great points, and it's definitely an area that needs more research. But it does make you wonder, right?
It really does.
And then there was another difference the study found. A higher percentage of concussions in women actually happened during practice rather than games, which is, well, it's kind of the opposite of what you'd expect.
Yeah, you'd think practices would be a more controlled environment.
Right. And that's why this finding raises some really important questions about coaching practices. Are the drills, even inadvertently creating a riskier environment?
Right, even without body checking.
Exactly. And I think it really highlights the need to look into those factors more closely, just to make sure we're creating the safest possible environment for all athletes, regardless of gender.
Absolutely. It seems like there's a lot to unpack there in terms of how those coaching strategies might be contributing to the risk.
Yeah, definitely a lot to consider.
But let's shift gears a bit and talk about recovery. We always hear about how long it takes to bounce back from a concussion, but this study suggests it's not quite that simple.
Oh, it's definitely not a one-size-fits-all situation. Recovery is way more complicated than just a time frame.
Yeah, what did they find specifically?
Well, one thing that was interesting was that female athletes were actually less likely to have like a delayed onset of symptoms.
Oh, interesting. So they're more aware of the injury right away.
Yeah, it seems that way. It could mean they're just more in tune with their bodies, or maybe more willing to, report those symptoms right away.
Right. That seems like a good thing, right? Greater awareness of a potential problem.
Potentially, yeah. But here's the catch. The study also found that females took significantly longer to reach, both the asymptomatic status and get full clearance to return to play.
So they recognize the injury sooner, but then it takes them longer to actually recover.
Yeah, it's a bit counterintuitive, isn't it?
It really is.
Yeah.
I mean, what could explain that discrepancy?
Well, there are a few possibilities, right? One thought is that it could be related to how symptoms are reported. Maybe females are just more sensitive to subtle changes, or maybe they're more willing to, to talk about those lingering effects. And so if they're reporting more symptoms, it's going to take longer to get cleared because they're not considered fully recovered until those, even the really minor ones, are gone.
Right. So it might not actually be that their brains are physically healing slower, but maybe more about how they experience and report those symptoms.
Yeah, it's a really interesting angle.
Definitely. But I guess we can't rule out the possibility that there are, actual physiological differences in how male and female brains respond to this kind of trauma.
Absolutely. And that's a really critical area for future research. There's a lot we still don't know. Like, hormonal factors, for example, could be playing a role in those recovery timelines.
Yeah, it's fascinating to think about how, those biological differences could be influencing things. It seems like we need a lot more research in this area, especially when you consider the implications for making those return-to-play decisions.
Oh, for sure. I mean, if we're seeing these trends, shouldn't our protocols reflect that? It kind of raises the question, should those return-to-play protocols be reevaluated, particularly for female athletes? Should they be factoring in these potential differences in how symptoms are reported and how long recovery actually takes?
That seems logical, but I imagine there are a lot of factors to consider, right? Trying to balance, the safety of the athlete with their desire to get back in the game as quickly as possible.
Oh, absolutely. It's a tough balancing act, for sure. We need to protect those athletes, but we also have to acknowledge that, having them sit out for too long, if it's not absolutely necessary, can have its own downsides.
This deep dive has really highlighted for me how much more research we need, to really understand all the nuances of concussion recovery.
Agreed. There's so much more to learn.
But maybe shifting gears a bit here, what about preventing these injuries in the first place? I mean, we talked about mouth guards, but are there other strategies that could be used to reduce concussion risk, especially during practice, where it seems like women are particularly vulnerable?
Oh, absolutely. And I think a key part of that is understanding how those injuries actually happen in the first place. We know that player-to-player contact is the main culprit, even without body checking. So minimizing those, those accidental collisions, both in games and in practice, is really crucial.
Yeah. And we were talking about coaching practices earlier, right? Could modifying those drills or training methods, could that help reduce those collisions?
Yeah, it's definitely something worth exploring. Like, are there ways to design drills that still emphasize skill development and those tactical plays, but without unnecessarily increasing the risk of of players bumping into each other.
Right, right.
And, I think coaches could also benefit from, more specific education on concussion risks and how to create a safer training environment.
That makes a lot of sense.
Yeah.
There's a real opportunity there to make a big impact.
For sure.
But, what about the players themselves? Besides wearing a mouth guard, is there anything they can do to protect themselves?
Well, I think education is huge. They need to be able to recognize the signs of a concussion, not just in themselves, but also in their teammates. And, we need to move away from that old school mentality of tough it out.
Yeah.
We've got to foster a culture where players feel like they can speak up and report any suspected head injury without fear of judgment or repercussions.
It's about creating that culture of safety and open communication, right?
Exactly. Players need to feel comfortable speaking up, and then the coaches and medical staff need to be, receptive and responsive to those concerns.
A team effort.
It really is. But, there's another piece of the puzzle we haven't even talked about yet, and that's equipment.
Oh, right. Well, we talked about mouth guards, but what other gear plays a role in concussion prevention?
Well, helmets are obviously the first line of defense, but, helmet technology is constantly evolving. So are we doing enough to ensure that, that players are using the most up-to-date helmets, that they fit properly, and that they offer the best protection possible? Are we really putting those helmets through rigorous testing, under real game conditions?
Those are really important considerations. It seems like there's so much potential for technology to really make a difference here in protecting athletes.
Oh, definitely. And there's also ongoing research into other types of protective gear, like neck collars and, specialized padding that can absorb those impact forces.
Wow. So it's a whole new frontier in concussion prevention.
It really is. But even with all those advancements, we can't lose sight of those foundational elements. Education, communication, and a culture that truly prioritizes safety over that old school toughness mentality. We need all of these pieces working together if we're going to make any real lasting progress on this issue of concussions in hockey.
Okay, we're back and ready to wrap up our deep dive into concussions in hockey. I feel like we've covered a lot of ground, talking about those surprising risk factors and especially the complexities of recovery, particularly for female athletes.
Yeah, it's been a really insightful discussion. And I think what's so important is how this information can be applied beyond just hockey,
Right.
This research has implications for anyone who's interested in concussions, whether you're, an athlete yourself, a coach, a parent, or just someone who wants to better understand this complex injury.
So for our listener who, might not be directly involved in the world of hockey, what are some of the big takeaways from this research? What should they be thinking about?
Well, one of the most important things I think we've learned is that assessing concussion risk is about more than just, those big hits.
Yeah.
This research really highlights those less obvious factors that can make an athlete more vulnerable, like those past concussions and even something as simple as whether or not they choose to wear a mouth guard.
Yeah, those choices can really reflect a whole attitude towards safety and risk.
Absolutely. And I think it's also a good reminder that concussions are complex and they can have, those long-term effects. And the research really, really drives home the point that recovery isn't a one-size-fits-all kind of thing.
Right.
We need to pay close attention to the unique needs and the experiences of female athletes, especially when you consider what we've learned about how they report symptoms and those differences in recovery timelines.
It really challenges us to rethink how we approach concussion management, to make sure we're really taking those sex-specific differences into account.
Yeah, for sure. I mean, we've got to ask ourselves, if women are recognizing those concussions faster, but then taking longer to fully recover, what does that mean for, those decisions about when they can get back on the ice?
Right.
Are the current protocols, are they really doing enough to consider those differences? These are the questions that we need to be grappling with,
Yeah, it definitely highlights the need for more research, to really get a better handle on all those nuances and to make sure that we're adapting our approaches accordingly.
Exactly. But even without having all the answers, I think just going through this deep dive, it gives you a foundation of knowledge. It encourages you to think critically about concussion risk, about recovery, and about the ways in which sex and gender can influence those experiences.
Yeah. It's about, being informed, being aware, and advocating for those better prevention and management strategies, right?
Absolutely. Whether you're a parent, a friend, a teammate, a coach, a fan, you have a role to play in creating that culture of safety and awareness around concussions.
That's a great message to end on. But, as always, we want to leave our listeners with something to think about, something to carry with them beyond this episode. What would you say that is today?
Well, it's interesting because if quickly recognizing a concussion is seen as a positive thing, but then taking longer to recover is viewed as a negative, how do we reconcile those two things? Does it change how we make those return to play decisions, or maybe it suggests that we need to to redefine what successful recovery actually looks like?
Those are really thought-provoking questions, and I definitely encourage everyone listening to keep exploring this topic.
Yeah.
There's so much more to discover, and your curiosity can make a difference. Thanks for joining us on this deep dive. Until next time, stay curious and stay informed.
Thanks for tuning in to the Science of Hockey. If you enjoyed today's episode, make sure to share it with your friends, teammates, or anyone who loves hockey as much as you do. Don't forget to subscribe so you never miss an episode. And we'd love to hear from you. Leave a comment to let us know what you liked, what you'd like to hear next, or any questions you have. Your feedback helps us make the show even better. Until next time, keep your skates sharp, your mind open, and keep chasing the science behind the game.